Alura is the product that launched NHT Global back in 2001. It's been 15 years. I invented the product. I am a gynecologist. In 1998 is when Viagra was released for men for sexual dysfunction. All of my patients said, you know, can I have some of the Viagra? And I said, well, Viagra's been proven ineffective for women. They said, well, why don't you develop something for us? We know that's what you do. So anyway, if you go to the next slide, I am a board-certified gynecologist. I practiced for 20 years, actually plus, more like 26. I have multiple patents on surgical devices and on drugs, but surgical devices mostly having to do with infertility and having to do with laparoscopic surgery. Not only do I do that, all four of my sons have patents and have developments, and the one son is a surgeon, a general surgeon. The other sons are biomedical engineers, and my youngest son has a PhD in drug development. So you can certainly see those are the things that hang on my wall because I am very proud of them. Those are my diplomas. I will move to the third slide. And this slide says exclusivity with NHT Global. The Alura product can only be sold by NHT Global and NHT Global distributors. The product is patented, has multiple worldwide patents. It is FDA approved in the United States. But the most important thing, and I think it's always best to, when you have a very popular product, that you can sell the product and no one else can. So essentially you have zero competition. Now I'm going to the next slide, the science. The science of the Alura is very important. It's based upon the nitric oxide synthase pathway, which is the exact same pathway of Viagra. And this is a pathway that was voted to win the Nobel Prize in Medicine in 1998. The ingredients in Alura are menthol and L-arginine. The menthol has 2 or 3 functions. The menthol initially has a cooling sensation when it's applied to the female genitalia, and it tells the patient that something is different, okay? The menthol then acts to deliver the L-arginine across the tissue and actually inside the genital tissues so that the L-arginine can stimulate the nitric oxide synthase system. So menthol, it's a 1-2 punch. Menthol is needed to get the L-arginine in. The L-arginine is needed to stimulate the nitric oxide synthase pathway and create nitric oxide. When I say the menthol has multiple functions, also the menthol is antibiotic. No bacteria of any type can grow in the presence of menthol. Now, that's something that I'll talk about in the middle of the presentation, and I'll talk about at the very end. This is a platform technology, you know, and it's like when you talk about a platform technology, this has to do with the nitric oxide dilates the blood vessels and brings in more blood, which brings in more oxygen. A platform technology means that you can use this product for multiple different applications. Moving on to the next slide that says L-arginine and nitric oxide. L-arginine stimulates the production of nitric oxide via the nitric oxide synthase pathway that was awarded the Nobel Prize. Nitric oxide is a gas and is easily communicated from cell to cell. It's a fairly transient gas. In other words, it only lasts a little bit of time, but it stimulates the production of cyclic GMP, which is a persistent and very long-acting vasodilator. So you see the picture, and the picture shows that the L-arginine takes a blood vessel and essentially expands it. It creates it and causes it to enlarge. Once again, when the blood vessel enlarges, it increases the blood flow, the blood supply, oxygen, nutrients, everything. Okay, I'm going to the next slide. The pathway of nitric oxide. And this is pretty involved science. There are three isoforms of nitric oxide. One form that is for the endothelial cells. Endothelial cells line blood vessels. The next are neuronal. Those are the NOS. And then the inducible. Inducible are 85% of the nitric oxide. Inducible means when you present a load of L-arginine that causes a huge amount of nitric oxide. It's like throwing gasoline onto a fire. So it's like the inducible nitric oxide is very important. That's the majority of it. The endothelial cells line the blood vessels. When you stimulate the endothelial nitric oxide synthase, it makes the blood vessels enlarge from the inside out. The nerve, NOS, takes the muscle tone that is dictated by the nerves, and it stimulates the nerves that surround and wrap around the blood vessels, causing the blood vessels to open up. And then the inducible nitric oxide, it's 85% of all nitric oxide, is actually in between the tissues. And that is the most potent. Okay, I'm moving to the next slide. Alura is classified as a topical vasodilator. Topical because you put it on the skin instead of ingesting it, or instead of injecting it. It's topical. It's a vasodilator because it causes the blood vessels to dilate. Now's a good time to talk about different types of skin. If you put the Alura on your arm, it won't make much difference because that skin is so thick and non-absorptive that the Alura doesn't get absorbed. If you put the Alura on your lips, it will become absorbed somewhat. Okay? In other words, this is a medium range because the lips you can penetrate somewhat, but not completely. If you put the Alura on genital tissues, especially a woman's genital tissues and the clitoris, absorbed very well. So this is like none, a medium amount, and a great deal is absorbed from the genital tissues. So, as we talk about a vasodilator, it depends upon what tissues you're putting it on. So I'm moving to the picture of the pretty lady in the yellow dress. And we're going to discuss the use of the topical vasodilator Alura in many different ways. Now, 15 years ago, I never envisioned the Alura being used any other way other than to help women achieve orgasm. For, all of the rest of these applications as vasodilators and topical vasodilators essentially were brought to me by NHT Global distributors. And I talk to my sons, and I think about it, and I research it, and a lot of them made a great deal of scientific and medical sense. And that's what I'm going to present to you. How a topical vasodilator, and especially how does it impact patients. As a topical vasodilator, a cranial vasodilator relieves headaches. Remember, all the blood that goes up into the head comes through the neck. Comes from the heart, through the neck, into the head. Headaches, and especially women, are plagued by headaches. Menstrual headaches surrounding the menstrual cycle, postmenopausal headaches, hot flash headaches. So it's like lots of people have told me, this works by putting it in my nose. Now, the nose tissue inside the nose is very much like the genital tissue for a woman. It's very absorptive. Other patients have told me they can put it on either side of their neck, right over the blood vessels that supply. And that's what we're showing with these pictures, is you can rub it on your temples. It'll have some effect. If you put it in your nose, it'll increase the blood vessels that supply blood and oxygen to the head and to the brain. And it has relieved headaches. It's an application as a topical vasodilator. Now I'm moving to the lip vasodilatation. Now, this is a little bit stranger. And the reason I say it's a little bit stranger is I have to introduce something a little more involved medically. If you use the Alura on your lips twice a day, 3 times a day, the menthol drives the L-arginine into the tissues. The L-arginine then makes nitric oxide. The nitric oxide stimulates the endothelial blood vessels to increase the blood supply and the oxygen. It increases the nerves, and you can feel it, and you can really feel it on your lips. It'll tingle, and it'll tingle for probably an hour to an hour and a half, maybe 2 hours. That's the nitric oxide stimulating the nerves. The inducible nitric oxide stimulates vasoendothelial growth factor. Now, that's actually a chemical. And we name things very strangely in medicine, but it's a vasoendothelial growth factor, VEGF. What the VEGF does is it increases that growth factor so that over a period of use for probably a month, 2 months, 3 months, you have the increased growth of actually the tissues underneath the surface of the lips. So once again, this is a vasodilator, topical vasodilator, that you can actually see. You can see its actions. Okay, now I'm on the slide for genital vasodilator. I'm a gynecologist once again, I invented this for my patients who, because as they go into their 30s and 40s and 50s, you know, their estrogen levels are declining normally, their testosterone levels are declining, and, you know, sex is declining, at least their pleasure from sex is declining, you know, and they like to be 20 again. Or at least they'd have to like to have the feelings like they were when they were 20. So the recommendation is to use Alura daily on the genital tissues, especially on the clitoris, after a shower or bath. And then liberally with intercourse, either before and during intercourse. The clinical studies report for orgasm responsiveness, which is the speed and ability to achieve orgasm. Now, is this Viagra cream for women? Absolutely. But the oral Viagra did not work for women. It caused too many problems. So the studies show that 66% increased speed to achieve orgasm, 65% increased the ability to achieve orgasm when they were having difficulties previously. And you can see the other numbers. You know, the numbers that most patients like is the increased ability to achieve multiple orgasms. That's something that women uniquely can do that men really can't. If I go to the next slide, genital vasodilator, increased sexual pleasure and sensitivity. Now, women have the initial response of sexual arousal for women is vaginal lubrication. You know, the vaginal lubrication is a reflex. When you apply the menthol and the L-arginine that is in the Alura to the genital tissue, all of a sudden we say, whoa, something's happening. Number two, the pleasure builds and lubrication occurs. You know, and this is Mother Nature's normal response for arousal so that women can be lubricated to be able to have intercourse. The quality of lubrication was 67%. The speed to arousal was 78%. And the overall improvement in arousal was 86%. Now, there are other numbers that are involved. 80% of women between the ages of 20 and 30 found they had improved lubrication, and 90% of women over the age of 35. The reason that this is important is that as ladies get older and their estrogen decreases every year and the testosterone decreases every year, arousal and lubrication is more of a challenge. And I will bring that up in another minute. So, genital vasodilator, increased sexual pleasure and sensitivity. The clinical study reports 98% of patients had good things to say about Alura in one of these 5 categories. Increased lubrication, increased ability to achieve orgasm, and that's the real reason. That's the real reason I invented this. I invented the Alura because men have a 90 to 98% chance of orgasm as long as they can have an erection. That's why Viagra was so welcomed by the aging male population. You know, but men have no troubles having an orgasm as long as they can have a penile erection. Women are the same, but they didn't know that. You have to have a clitoral erection. And the clitoris in the woman is the same organ as the penis in the man. You have to have a clitoral erection so that the clitoris is maximally sensitive and stimulatable. And then you can achieve orgasm from the continued stimulation of the clitoris. So number 5 is the ability to achieve multiple orgasms. And multiple patients have told me that's what they appreciate the most. Okay. Fertility vasodilatation. This is strange. In 2004, in 2005, multiple NHT Global distributors would come up to me and say, you know, I've been trying to have a baby for 5 years and been to so many different specialists, and I never got pregnant. I started using the Alura, and I got pregnant. How come? You know, and it's like I didn't hear this story once or twice. I heard this story a couple hundred times. Now, I said I'm a gynecologist, but my subspecialty is infertility. My partner and I developed the forerunner of the in vitro fertilization. So when patients told me they got pregnant, I couldn't figure it out for several years. And finally I figured out it's the vaginal lubrication, that the sexual arousal lubrication, which is a natural conception lubrication. Natural because you make it with arousal. Women make it with arousal. It's a lubrication to allow intercourse. But what it does is that lubrication strips the cholesterol off of the sperm, allows them to have the mobility and motility to swim the 6 or 7 inches up through the cervix, through uterus, through the fallopian tubes, to finally fertilize the ovum, which is the egg, at the very distal end of the fallopian tube. So it's like, think of these sperm as being held captive by the cholesterol and needing the natural conception lubrication to capacitate the sperm. Capacitation is a medical term, means giving the capacity or giving the ability to be able to function normally to fertilize the ovum. Now, what is strange is the vaginal lubrication is the water component of blood. This is pretty entailed, but the nitric oxide synthase and the reflex reaction of the vaginal lining, and this is a reflex because you can put the Alura on the outside. This makes the blood vessels inside the vagina permeable. Permeable means leaky, okay? It's like a screen, and it's like it holds back the blood cells, but it allows the water to travel inside the vagina. That's called a transudate. So it's like it's the arousal, it's the arousal from the Alura that causes the natural conception lubrication that capacitates the sperm. Now, this is not a big market, but this is a very important market for patients who have had challenges. 50% of infertility patients are infertile because of the male subfertility factor or unknown factors. But this is a way a woman can use Alura, natural conception lubrication, to make up for male subfertility. Okay, the next slide is anal vasodilatation. An anal fissure is like a chronic ulcer that won't heal. You've seen in the wintertime people get cracks on the side of their mouth that you just can't get them to heal. That's what a fissure is like. Also, hemorrhoids are right within the same area. Well, this is an area that, always has bacteria in it because of feces. So it's very hard for an anal fissure to heal. Using the Alura, they do heal. How come? For two reasons. Number one, it's antibacterial and will, at least for a short period of time, suppress the bacteria. Number two, is a topical vasodilator. It brings in more blood vessels to heal that the ulcer. So you have increased blood flow, increased oxygen. Also, you have the vasoendothelial growth factor to heal this. In the United States, you can't operate on these. It's usually miserable when you do. All of the insurance companies in the United States dictate that, first of all, you have to have a nitric oxide stimulating L-arginine cream. You have to use that at least 3 or 4 times per day for 6 weeks, and if that doesn't heal the anal fissure, then you can have surgery and the insurance company will pay for it. So this is accepted medical therapy to use an L-arginine cream, and usually it's a 2% cream, but the pharmacists have to make it up. It's not really available commercially. I'm now on the cutaneous vasodilatation. An ulcer on the foot is a diabetic ulcer, usually. It's because of poor, and what happens with diabetes is it's a microvascular disease where you just can't bring enough oxygen and nutrients in with the blood because the vessels clamp down because of the diabetes. Once again, diabetes is a microvascular disease. In other words, it's a disease of small blood vessels. So you don't have enough blood. All of a sudden, you develop an ulcer. You can use the Alura on this. Now, you have to use it 3 or 4 times a day. What it does is it decreases the bacterial count of the skin to allow healing. Number 2, is a vasodilator. It brings in more blood, more oxygen, more nutrients to promote healing of the tissue that hasn't had good blood supply. Okay? Now, if it works for ulcers, does it work for other cuts and scrapes and abrasions? I certainly use it on my grandchildren. When they get a cut out of the driveway, I put it on there and it works very well. So I use it on my own grandchildren. Now the next slide. This is the tips for the best use of Alura as a Viagra cream for women. Use it daily after shower or bath because it restores the tissues that are declining because of declining estrogen and testosterone in women. Use it before intercourse for enhanced pleasure. Use it on the peak days of fertility for increased chance of conception. And it's like, let's face it, you have to be intimate to be able to have a chance of conception. The Alura increases intimacy and increases conception. Once again, it's a small market, but it's a very important market. At least 2 of my 8 grandchildren were conceived with the help of Alura. So, in summary, is Alura an important product? I like it, I'm very fond of it. Women are very fond of it. My wife's a professor of English. All of her friends are very fond of it. Matter of fact, and of course we have it free here. And my wife is like a drug dealer. She supplies it to all of her friends that are also professors, and they're in their 40s and 50s. Well, guess what? One of them, who was 35 and whose husband has sperm motility problems, and they were told they would never have children, she just turned up pregnant before Christmas. So yes, that happens like that. So, in summary, multiple positive benefits for women at every age of life, patented exclusive formulation, FDA approved, and the most important thing that I started with and then I'm going to end with is that NHT Global has the exclusive ability to sell this so that you have no competition with anybody else. NHT Global also has exclusive access to me to have me come and promote it to you, to your downline, to your distributors, which brings me to another point. This fall, my wife and I will be in Europe. I don't know if we'll be in Paris, or if we'll be in Rome, or if we'll be in Istanbul, or if we'll be in all three of those and many other places. My wife is now a full professor, and with that, they gave her a sabbatical of 6 months. And I said, what do you want to do? And she said, I want to go to Europe. Now, we've been to Europe multiple times, and we love it. I was trying to count the other day. We've been to Rome, I think, 10 times, and all through Italy. So, yes, we will be there sometime in the fall. Now, the very last slide, Alura Lux. Alura Lux is the exact same Alura formulation, but it's paraben-free. How can it be paraben-free? Paraben, first of all, is a preservative. Anything that is a topical cream has to have a preservative in it, because creams can have bacteria that just fall out of the air, fall onto the creams, and they start growing. So you have to have a preservative that prevents the growth of that bacteria. Well, guess what? Menthol prevents the growth of the bacteria by its nature, by its chemical nature. So over the past, multiple months, Karen said to me one time, we would love to have a paraben-free formulation. I said, we can do that. All we have to do is take out all of the parabens, because we've already previously proven that the menthol and the concentration of the menthol is adequate to prevent the growth of bacteria. Then Karen and NHT Global had to establish that for the FDA with preservative effectiveness testing. That takes, months and months and months and months and months, sometimes as long as a year or sometimes 2 years. So this is good. The Alura Lux is the same old Alura, works exactly the same, but it doesn't have the questions of paraben and what the parabens have been implicated in as far as being hormone-disrupting compounds and hormone-disrupting chemicals, especially for women. And I even have some reports that, and I've shared these with Karen, that it causes, that parabens can be involved with premature menopause, and like bringing on menopause for women 2 or 3 years earlier. Now, that's all completely, it's unproven. You can't prove anything in medicine unless you can prove it 3 different times in 3 different large studies. But it's enough to be concerned about it. If we can easily do away with it, we do away with it. So the new product is Alura Lux. And actually that's Karen's product. She asked for it. Now I am glad and to accept